Hey guys, how are
Hey,
you?
good.
Thank
How
you
are
for
you?
coming. I'm
Oh,
good.
I'm excited.
Yeah. So, um, we've been talking and planning this for months, and we're like, finally, like, we're going to like sit down and chat and talk about like natural therapies and how it can help people with Parkinson's. I'm gonna get you to bring your mic.
Sure.
So one, they can see your face, and one, two, I can hear you. So, why don't you do a little history and background on yourself and how you've gotten connected with Parkinson's and your experiences?
Exactly. So I was conventionally trained in nutrition, started off at the University of Guelph, finished off at Ryerson University, and then started working in hospitals, pretty much, almost all of the major hospitals in Toronto, as a dietitian's assistant, food service supervisor, and I was seeing what we were feeding our patients, and I wasn't too happy about that.
Mm-hmm.
And so that kind of was the impetus to get me to start looking at more natural modalities of eating, taking care of ourselves.
Mm-hmm.
And then I started a course at the Canadian School of Natural Nutrition, and that was just the door that kind of opened up my eyes to, the natural world. And I became so interested, and that kind of got me started on, supplements, because we do need to supplement. Our
Sure.
world is toxic. Our food is not the greatest. Our soils are not the greatest. As nutritionists, we know that. So we do have to do the supplementation. It's not the way it was like 40, 50, 60 years ago.
I agree. I mean, just two things. You had, originally you were you were a dietitian,
No, I was never, I
or
didn't do my
or
internship.
you
but
did your
that's the
training.
route I
Now
took.
you're so
Yes.
a lot of people when they hear dietitian versus nutrition or nutritionist, they don't know the difference. And I tell them it's like a big border, a big wall in between
Yes.
those two
Yes.
worlds.
Yes.
They think, well, you just talk about diets, and no, it's actually there's the dietitian world is like a piece of the Western medical paradigm,
Right.
your MD perspective. So you're not getting maybe the nutrition that, if you go to a nutritional expert, you go to the health food store, you start doing some research, you're not talking the same language as the dietitian.
They're very similar in one way, but they need to marry more.
Never.
No, I agree with you because that's what got me going the other direction.
Yeah.
But I have a very good friend, Philomena, who's in this community here, who I know she incorporates a lot of the natural stuff.
Good for her.
And she's a registered dietitian. She's won many awards in
Mm-hmm.
this community. She still carries the mandates of the Canadian Dietetic Association.
Sure.
But, they're open to these things. And it's the same way that I was then open to this stuff. So there is a fine line. There definitely is. I don't always agree with like the food paradigm and all that stuff.
I did a Instagram post. I created a new food pyramid
Good.
for
Is it
2025.
upside down?
Well, yeah. I mean, because I don't know if they necessarily stick to a pyramid nowadays. And usually you see a plate and you see how it breaks it down. And I usually go to the old school, like Canada Food Guide. And what was like 5 to 11 grains
Remember?
per day.
And you
Imagine.
wonder why we're diabetic.
Yeah.
We're wondering why there's obesity. We don't need that many carbs and stuff.
I think I had one serving of grain per day on my.
I'd love more, but
Well, that's the thing. I think we cater to what we like as
Yeah.
opposed to what's like actually making us healthy.
right.
So these conversations, I think, are helping redirect, the older generation and also the younger generation that's caring for their adult or senior parents, because now they live their life. They've consumed most of the food they're going to eat in their life, and that whatever buildup or accumulation, there's limited things that we can reverse, but there's a lot of things that we can improve. So maybe talk about like what you experienced with like nutrition and how you've been able to incorporate that into people's lives.
Well, I mean, I never counseled my nutrition in the hospitals I worked at. I had to follow their mandates. What I did do was talk to friends and family, and I've had cousins tell me, why don't you book your party room and have us all come and we'll just listen to you talk? And I really want to do that.
Yeah.
And it's these kind of platforms right here that I just love.
That's good.
I thank you for inviting me.
Yeah.
And I was able to apply it to certain ailments that I've had. I have been able to mitigate some of the issues that I was having. Gut health is extremely important. A lot of Western medicine does not correlate gut health to a lot of other diseases that we have.
Yeah. Do you know why? Because, I mean, it's reductionist.
Oh, okay. I know what you're saying.
Yeah. But then also, like, food and your gut, that's like too woohoo. Like, to say anything disease or pathological can stem from your, variations in diet or variations in gut biome, you sound like a quack. But
well,
the thing,
we call it the second brain, and it truly, truly is.
Yeah.
The gut-brain barrier axis is so important, and unfortunately, doctors don't see it. And that's where, in a lot of disease states, like Parkinson's, I brought along just a couple of things that I like to use.
Just a couple.
Just a couple. Only about, 10? Things
But that because
foundational
of course,
things, right? And it's so important because, again, like we keep saying, especially in Parkinson's, in my opinion and in my research, is a disease where you were exposed to something environmental, chemical. And in my dad's case, it proves true. And I know a few people, about 4 people, that the same thing, their parents or their loved
like in
one.
Industry,
Chemical
exposure, their work.
Yes,
Oh, so
yes.
interesting. Okay.
And so it causes this neurological effect, and it can lead. Again, we have to look at the weakest link in our body, right? If it happened to me, it might have been a liver, because I do have liver issues.
Sure.
So it might have exposed itself or manifested itself in a liver thing.
Yeah.
But as far as Parkinson's, the tendency to see it as something that you've been exposed to in your childhood, in your early life, and then it manifests later on in life when you get it with something chemical. But again, going back to what I said, our world is way too chemicalized, way too much toxins. Our food isn't good. So this is where I think the nutritionist comes in, and we can help support the foundation.
Yeah.
And I even have a big thing about water, the water we drink.
Okay.
Stay away from tap water.
Well,
Too much chlorine.
I just gave you a plastic bottle. Sorry.
I know. Well, you know what? That sometimes just can't be avoided.
But there's some people who won't even shower or bathe in city water. They'll apply a filter. Yeah?
Yeah.
Oh, well, I didn't know
I
that.
have friends that do that too. They did their whole house. There's a guy just next door to you.
Okay.
A water place right next door to the restaurant over there. He's a great guy. Go see him. He can do your whole house.
Okay, so I mean, because people are watching, and I'm sure people watch after. Like, what kind of water should someone drink? I mean, this is sort of like just for general, not just Parkinson's.
Okay.
No,
I would start with, this is not the best, but this is better than tap water. Do you see what I'm saying?
So it's some level of refinery, right?
When you have someone that is just starting out, I've been to a few Parkinson's talks, and I could feel the group. So you got to start slow, or you lose the people.
Yeah,
you lose them. If you overwhelm them, you lose them. We've got to help educate them and build them up, and get the right foods and water in them. Let's start with not using tap water.
Sure.
And maybe go to bottled water. Yeah. You can get reverse osmosis systems.
Sure.
You want to remineralize it, because reverse osmosis cleans it out so much that it's practically too clean.
Yeah.
And you want to remineralize it.
Sure.
I mean, there's so much. This can be we can do a topic just on this
alone. I think we're kind of hitting the points where if you have a loved one who has Parkinson's, where you intervene naturally, it depends on what your starting off point is. If you're
and how old they are too.
Yeah, and how willing and how feasible there's change. Yeah. Like if you're and when I have senior patients of like any kind of condition, I can't give them the same protocol I give someone when they're 30, because if I start changing all their dietary habits, I start giving them too much exercise, they're going to not know what to eat. They're going to be confused. And it's overwhelming. So you kind of need to address them where they're at. And it also helps that when they have a caregiver that is already inclined naturally, they're already probably adopting some things themselves. And it's just, slowly transiting the loved one to a lifestyle that still works for them, but is like, hey, you know what? I've noticed that you dropped 5 pounds ever since you changed your water. I noticed that you're sleeping better because we put like an air filter in your room. Well, these little subtle changes, they're starting to walk instead of sitting on the couch all day. So, we want to like jump into the science of Parkinson's and natural therapies, but we do recognize that it's like there's such a learning curve that we don't want to overwhelm, because when people come in, they're like, my head's spinning. I have to like process all this information you gave me because like, I mean, I got an hour with the person. I'm just meeting the family. They're like, okay, you're telling us we have to do all of this stuff. I don't even know where to start. So like we have to do baby steps sometimes.
It's the only way you're going to get any sort of success. You can't overwhelm the client.
Sure.
And they don't even understand what's happening to them. So we want to start slow.
Yeah.
I've done a few Parkinson's talks, and what I've started with is the water. Try to drink cleaner water.
Sure.
Exercise for sure. I mean, you don't have to be a nutritionist or a doctor to say add the exercise in. Parkinson's is very well known that you need to exercise.
And people don't get it at first. They think like this is more work, and they think muscles when you think exercise, but it actually is oxygen.
Yes.
Oxygen to the brain.
Yes, right. And that's where the problems are happening.
Yeah.
But it's also the muscles that need to be oxygenated.
Yeah.
So, right? The oxygen all over.
And they're very tonic and like they're hyperspastic, and you need to kind of like both like allow movement to like movement can be relaxing at the same time, whether it's slow walking or stretching. Not all exercise is like pumping iron. Like, so we got to like,
we're not talking that. We're talking even just getting out and doing a daily walk.
Yeah. Because we're breaking down a lot of the constructs that we people like understand. There's like a nice to someone, hey, we're going to look at your diet. They think I have to lose weight. I'm like,
or they lie. They I'll ask for a 3-day journal.
Oh boy.
And it's like,
you're lucky.
This is perfect. You know?
Did you say something? Well, that is a good point.
There's Patrick Losasso. If you go on his site, they do chair exercises for Parkinson's. It's amazing.
I think there's always something that can be done, and we do recognize that there's limitations. Like we can't, walking. We don't presume this is the easiest thing for everyone, but there is always things that we can accommodate. Like I have a team of kinesiologists. They're pretty much personal trainers that with such a high level of education that they understand different disease groups and individuals there that whatever their limitation is, we modify the exercises so that they can get a therapeutic benefit without, hitting a wall and they're like, you know what, I'm sorry, you can't stand up, you can't do exercise. That's not the case.
They have OTs that will come into the homes.
Sure.
They've done it with my dad. They will assess their level of proficiency, like what can they do, and they will send a physiotherapist. They try to teach them. They'll send them for like 5 or 6 sessions, and then they're to continue doing them at home. So there's no excuse. I always tell my dad, no excuse. You can do it. And again, chair exercises, stress balls, just even bands, sitting down, just getting those muscles moving.
I like those. There's a few different brands where it looks pretty much like the pedals of a stationary bike. So they're seated and you strap their feet in, and even if they're just, it's not but it's movement. And over time you'll notice after a couple of weeks they're getting a good rhythm and they look forward to it because it's still passive enough that they're not going to be exhausted.
And they're not going to injure themselves.
Yeah.
And they feel confident that they can do it without any help.
Yeah.
So exercise, good water. And then I ask them, can I see, what you typically eat? And I like to have a family member with them.
Sure.
And, I try to take it with a grain of salt because it's always such a perfect list. What I really stress, because the Parkinson's people have so many tremors, they tend to burn a lot of calories.
Sure. And
they lose weight. My father has lost so much weight. And it's like, you don't realize it, but they do lose a lot of weight. So I stress, make sure you have a protein source in every meal that you eat.
Yes.
And so they'll ask me, why? What? Or, so I explain it to them. And, just a gentle reminder, you can eat meat for breakfast.
Sure.
You can have the leftover steak the night before for breakfast.
I'm glad you're saying this.
High, protein content.
Well, the diet is really something that, again, more constructs that we have to like break down and rebuild because a lot of the times their diet is carb heavy.
Right.
But then they've also been scared off of saturated fats, meat, because most of them are on cholesterol meds. Or they have high blood pressure and they've gotten scared by an MD or a dietitian. It's like,
don't eat butter, don't eat meat. No, it's all debunked. It's all not true.
Yeah, well, just my little commercial for, it doesn't necessarily have to be full-on ketogenic dieting.
No.
But maybe looking at a little bit more protein and fat.
Absolutely.
Because when we look at research and we're looking at any kind of neurological deficits, and Parkinson's included in that, there's a huge amount of studies that are showing the benefits of keto, the benefits of fats, increasing the fat content, and also watching the carbs. So there's so many conditions that we're saying are like type 3 diabetes, like neurological.
They're called type 3.
Yeah, because we know what, and we're learning more about the damage that high glucose diets are having.
That happens.
Yeah. And then people are saying, well, doesn't your brain use glucose as fuel? And the truth,
we think we need so much, but we don't.
And
you do need it. You can't live without it. You will die.
Right. But also fat becomes ketones.
Right.
And ketones are actually more effective for brain function. Mm-hmm. So they actually sell ketone supplementation for people that want to improve their focus and neurological benefit.
Right.
So, I mean, that's another topic. But
fats, sorry to interrupt.
No, it's okay.
Fats are really good for, because Parkinson's is such a neurological disease.
Yep.
Don't forget that the nerve ending, the nerves with the myelin sheath
around
it.
Protective.
That's very protective of it, supports it, and helps it grow.
Yeah. So, I mean, I had grabbed Tudka, and you noticed it.
I love Tudka. I use Tudka.
So it's a bile acid, and really just looking at, preparing for this talk, I kept going back to the fact that it's interesting that something that helps with bile and fat metabolism is supporting and helping Parkinson's patients. But when they go on a statin to lower their cholesterol, it's the antidote to this. It's undoing, or actually the Tudka is trying to repair.
What the statin
So we got it's a conflict.
Battle.
Yeah.
Oh, it's a battle. I got my dad off the statins, and it's really helped him. Here's another thing in Parkinson's, which I'm noticing in the progression of the disease for my dad. They have swallowing issues eventually, and that's because the peristalsis is starting to get weak.
Sure.
They can't swallow, and they start to choke. That's a very dysphagia.
Yes.
It starts to happen, and then they don't digest. My dad now is in gastroparesis, so that's what can lead. So from the lack of digestion, the lack of peristalsis, the lack of movement, the constipation, they can end up with, especially the older people, with gastroparesis. They're not digesting, they're not getting the nutrients from their foods. Tudka and enzymes.
Oh, I'm glad you said enzymes.
And did I bring it? Oh, I didn't bring it. Hydrochloric acid.
Yeah, I love that.
You put those three together, and you could even kind of like go back and forth. All of a sudden, the food that sits like a rock in the stomach of these poor Parkinson's patients who want to eat because they want to gain back their weight and their strength, it's better. It gets digested more, and the nutrients get distributed throughout the body more.
You're like, we're on the same page, because most of my patients leave with an enzyme or betaine. Because when I'm doing their body composition, I'm looking at how much muscle mass they have in comparison or versus their body fat. And we're seeing like a huge increase in individuals that their body fat is increasing. Their caloric intake seems okay, but their muscle mass is like, there's a strong deficit. And they don't see why. And even people who are training, they're like, why am I not gaining muscle? When we're bringing an enzyme or the betaine, the hydrochloric acid,
you're releasing all the amino acids to go in and build muscles.
So our stress response prevents our natural production of that. Right. We think that just because the food's on our plate, we have a nice amount of protein, I got a steak, it's just going to go where it needs to go.
No,
it doesn't.
Has to be broken down into its small components, which are amino acids.
Yeah, so the enzyme releases that.
But a good one, and this is one that I use, and I like it. There's so many good ones out there.
Yeah.
Pure gives a good one too, but really good, and it helps them.
I like the ones with ox bile.
Yes.
Yeah.
Right.
And then sometimes they have hydrochloric, or you you add that in. We don't realize how important that is. And people say, like, why do you take so many supplements? I'm like, well, we actually try to like minimize. And when we use something like this, what we're trying to do is upregulate a natural function that's been dormant. We don't know. We don't see that our stomach is underproducing stomach acid. Sometimes we'll actually have the opposite. We'll have like heartburn after a meal.
GERD.
Yeah, and they're like, well, then you need a proton pump inhibitor to reduce your acid.
That
blocks it worse.
Lowers the HCl, which is the hydrochloric acid, which we need to digest our food. So you're kind of like between a rock and a hard place. It's lowering the HCl because you got acid reflux.
Just
you
do
need
DGL.
The HCl. Right? DGL, diglycerized licorice or whatever. Yeah,
just treat the symptom, but then don't kill off your stomach acid.
You need your HCl.
Yeah.
So,
and betaine is great to reverse GERD.
Yes, yes.
Because
okay.
once you prompt the stomach to produce acid
Its own
earlier,
acid,
it
yeah.
won't do a rebound production
Right.
after the meal. So you got food and then acid, and of course you're going to have reflux.
And then they can get the digestion that
Yeah.
they need. And here I go back to the gut,
Brain.
and the whole, all our organs. They're
Yeah.
so connected. See, this is where Western medicine goes wrong. There's a specialist in every field. There's a liver specialist. There's a kidney specialist. There's this. We are so connected. The body can't, work on one organ on its own. And that's what we need. We need to get that symmetry going between them.
Yeah. So I mean, we have a multidisciplinary clinic here. So when I've got a patient with like a complex condition, we try to integrate other practitioners and modalities. Like, I mean, I'm a strong proponent of like acupuncture, of massage, chiropractic.
all.
Yeah. Yeah, and people get scared when you say chiropractic. I'm like, they're not cracking you.
No.
They're looking at your range of motion, your joint health. They give you
Networks, a spinal analysis. I
Absolutely.
do the one where he doesn't even touch me, and he's a chiropractor.
Yeah. But I mean, we're treating everything, and like the brain down through the nervous system and nerve endings, like everything is affecting everything. So you're gonna have to have more a complementary approach.
Right.
And people they have to get used to the idea of having a team. Like it's not just your doctor or neurologist. You start expanding. You got a nutritionist, you got a naturopath, you got your acupuncture, you got your massage, you got all these different, because it's a maintenance. And like if we tell that to like a healthy 30-year-old, of course, 70, 80-year-old with a condition, they're going to need that kind of care as well.
And we're going to get really good success if we really push this because I was approached by one of the people with the Parkinson's Association who said, would you come and do a talk at night? I said, I'll do it anytime. We're getting more young people being diagnosed with Parkinson's.
Wow.
So they're going to be the ones more willing to take the supplements because they're still young. They're raising families. They're 30 and 40-year-olds
Yes.
getting Parkinson's. We're going to get a lot of success with them and give them a better quality of life
Sure.
if we can provide for them the tools to keep their guts going, to keep their brains going, teach them about the importance of a good high-protein diet.
Sure. And they're privy to this information because they're on social media. And
Yes,
we're dealing with
exactly.
seniors. They come from the old school. Like they didn't have social media. They didn't do their own research. Their family doctor was, lowercase g God for them.
Oh,
and
still,
everything.
still
And
God. White
and
coat.
but now if it is affecting younger generations, now we're able to say, like, listen, you already have some background. Let's make it clear to you, like, how this is actually beneficial for you in your specific case. And every case is different. There's not like just a standard, you're going to take X, Y, and Z because that's what the
No.
textbook says. It's
I
not
don't
like
believe
that.
there's not one size fits all.
Right.
And you got to look at each individual because my dad has other disease states going on.
Sure.
And you can help mitigate those things with the different, like a supplement that works for you. And actually, for example, enzymes for somebody that doesn't have Parkinson's works for a reason. For my dad,
100%.
it works for a different reason.
Sure.
Parkinson's people have trouble sleeping at night. And I always tell them, take magnesium bisglycinate.
Yeah.
That's a better one for sleep. There's so many different types of magnesium. I find this one works best for sleeping.
Sure.
Zinc. Where's my zinc? Oh, vitamin D plus K2. That's another really good supplement to take. Really good for these people. Their immune systems tend to go off, especially the elderly ones. And you're going to get them to be resistant. Now, this might be too much for the average elderly person.
Yeah, but you would customize it,
And I prioritize.
Yeah.
I would prioritize what's going on that is really important that we want to start with.
Sure.
For the immune system, zinc and vitamin C, and again, vitamin C that has camu.
Okay.
Because we don't want it to have the citric acid. You want more of a natural vitamin C, and it works better with zinc for the immune system. My dad used to suffer. Every December, you would get this tickle in his throat and get this cough. Since I started this protocol on him, he hasn't had a cough, hasn't had a cold,
Good for him.
anything, even during COVID.
Yeah.
So things like quercetin and NAC, two very important, and they serve so many purposes, I'm sure you know. not just Parkinson's. I mean, this is just more of a immune boosting.
Yeah, cell protective. It's really good. Yeah.
And see, this can be something that you might just want to leave out at first and just deal with the real foundational things.
Yeah, exactly.
And again, a good probiotic.
Yeah.
Always a good probiotic, again, to help the digestion, to keep the colonies of your good bacteria.
Sure.
Because they're on so many medications. What do medications do? They kill the good bacteria.
Yeah.
We want to keep replenishing those bacteria.
And we recognize that this is for a caregiver to kind of manage, and you know, it makes sense because, you know, the individual, they're already kind of suffering, they're already overwhelmed with their condition, that they need the support, and so we recognize that, like, we were working with a family unit as opposed to just.
They usually do come in with a family
Yeah,
member, because it's usually the elderly.
Of course.
And then if this is too overwhelming, right? Like if this is just too much, I ask, is sleep an issue? That's when I'd make this more important. Is digestion an issue?
Sure.
And I would make that more important. And then if this is all just too much, you can get a really good multivitamin.
Sure.
Really good multivitamin that might incorporate these.
Sure.
So then it's less, because this is overwhelming.
I got to do my commercial. Don't go to the drugstore. Well,
don't go to Walmart.
Don't go to
Costco.
Yeah.
Just, you know why? Because there's just
but
so
you know
many
what? Their
ingredients.
doctor tells them those are the only ones that
Yeah.
you should use,
Yeah.
because they're under a false
Stay away from
impression.
Centrum.
Yeah. I mean, it's not to knock brands, but
It's not about the brand. It's
but
what the ingredients are.
the products that we're highlighting, these are like pharmaceutical grade professional lines that almost
cleaner. That's my most
and
important
with
thing.
the therapeutic dosage that is appropriate for what it's supposed to treat. Like, these all have NPNs. They all have like a drug identification number. So Health Canada's already cleared these. This has exactly what it says it has, and it does what it says it does. There is no, well, these are not regulated. That's nonsense. I heard that for 30 years. It's especially in Canada. I mean, remember where we are. Everything is regulated. It's tight. It's tighter than medications. So,
Well, because they're trying to replace medications. Because, you know, Big Pharma, our enemy, unfortunately. I mean, I
it's
have
getting
benefited.
political now.
Well, I benefited from Big Pharma. I mean, I don't want to put it down, but they're
Yeah. There's a paradigm conflict. And you know what? All we're trying to do is say there are natural, safe, and effective therapies that we have available to you. You just have to talk to the right people. Like, this isn't medical advice. This is information.
This is experiential advice. I'm speaking based on what I've done with my
Empirical.
father.
Yeah, you've gone through it.
And other people that I've helped who have had Parkinson's,
Mm-hmm.
as well as speaking to the top-notch Western medicine people at a very well-known Toronto hospital that deal with Parkinson's.
Yeah.
And they are so happy that I've introduced, like, I love them that they are open to inviting natural remedies into the therapy. And again, it's not a one-size-fits-all.
Sure.
It's going to be very personal.
Mm-hmm.
And seeing a professional in the natural industry can really be beneficial.
Absolutely. Yeah.
I really think that they could benefit from it and live a better life, especially the younger people being diagnosed with Parkinson's.
Yeah. I'm just going to throw out there, just going back to the oxygen, we use hyperbaric oxygen therapy here.
You have it here?
Yeah.
Wonderful.
Yeah. And there's a few clinics in Toronto that,
There is.
but they're not that many. And the understanding of it is like you're getting oxygen under pressure. And that's helping with oxygen saturation through your tissues, but especially to the brain.
Right to the nucleus of the cell.
Yeah,
Like
and the
this is-
brain.
Yes.
So increasing oxygen perfusion. And, you know, when they do scans of, you know, whether it's Parkinson's, Alzheimer's, post-concussion, before and after a series of hyperbaric oxygen, you're seeing dark spots. And then you're seeing that light up because that means there's blood flow. That means there's better function. So there's a lot of potential there. There's a lot of studies highlighting the benefits of that. And I mean, I think that's what today is about, is just highlighting that there's so much information, there's so much benefit, there's so much study going on, and that has gone on.
Legitimate study too.
Yeah, this
Not
is
just-
this
yeah.
is university level. This is, you know, it's not you know, took a group of 10 people and you know, my friends of mine. This is on PubMed, and so
Amazing.
yeah, and it's encouraging. And when you have a patient that comes in, you start seeing them feel a little bit more in control. They feel a little bit stronger. The feedback from the patient, the family is better. The feedback from the neurologists are improving. We were just hoping that, we have an increase in their quality of life, maybe less reliance on medication or not needing to increase, because then you're getting side effects with that. And then just overall, like, you just see them living a healthier, happier life.
When you feel good, you want to do it more. You want to do more.
Motivation to do
right?
things.
You feel good.
Sure.
You want to get out there more. You want to do the stuff that's been making you feel good. It's a win-win.
Yeah. Well, this is wonderful. This was a really nice conversation.
There's so much we could talk about.
Yeah, I think we got to do part 2.
We got to do at least 2 or more, 2 or 3 more.
All right.
Thank you for having me.
Yeah, I'm glad. I know people were joining us and watching, and I'm sure that we'll have some viewers afterwards, and we'll have some contact information for both of us, and just so that we can reach out and answer some more questions.
Would love to.